BinaxNOW has great potential to be a test that we can use for widespread COVID-19 testing in the general population. We want widespread testing so we can go back to a more normal lifestyle. Kids want to go to school, people need to go to work, we want to go to sporting events, there's football games on this fall. I'd like to go see a movie. I don't know about you guys, but it's been a while, right? So we need widespread testing so we can feel free to move about in society while this pandemic is still ongoing. Widespread testing means that we are going to test everyone in the general population at regular intervals. So we're going to need lots of tests to be able to do this. And so BinaxNOW is one of those tests that's coming out. It's actually out this month. But we need tests that are cheap, fast, and easy to use if they're going to be realistic choices to do this widespread testing. So let's go through BinaxNOW and see if that meets our criteria. Before we get into the pros and cons of BinaxNOW, let me introduce myself. I'm Dr. Rachel Johns. I'm an internal medicine hospitalist working out of Southern California. There's a lot of companies right now working on a lot of tests, a lot of vaccines. There's going to be a lot of stuff coming out in the next couple months. So I would really appreciate it if you would subscribe to my channel so you don't miss any of these important updates. So as I said, we want tests that are cheap, fast, and easy to use if they're going to be realistic choices for widespread testing. So is BinaxNOW cheap? The company that's producing it, Abbott, is advertising that's going to cost $5. I don't yet know if that's $5 to the consumer, which is all of us, but like I said, it's coming out this month, so I will find out and let you know. Is BinaxNOW fast? The test actually takes 15 minutes. It's a rapid point-of-care test. Point-of-care means that they're doing the test at the place where you are actually getting the test done, being in a doctor's office or a testing center. So you go and get your nasal swab done. They actually put it into the kit, which is about the size of a credit card, couple drops of reagent, close it up, and in 15 minutes you'll get a visual readout of your test results. And it's kind of like a pregnancy test. 2 lines you have COVID and 1 line you don't. It also partners with a smartphone app called Navica where you download your result with a QR code and then you can show it on your smartphone to any official person who needs to know if you are positive or negative for COVID. Is BinaxNOW easy? So yes, it's a nasal swab. It's not a nasopharyngeal swab which has to go all the way back to the ends of your nasal passages. It just goes right here in the tip of your nose. They take a quick little swab and put it in the kit and you're done. It still needs to be done by a healthcare professional, but again, it's an anterior nasal swab, not a nasopharyngeal swab, so that makes it a whole lot easier and more comfortable. Now, let's talk about the downsides of BinaxNOW. Like I said, it is a kit, and any kit has to be manufactured. It might not be enough. We could have a shortage. So Abbott is shipping out 50 million tests per month. Well, we have, 350 million people just in the United States, and we need to be testing at least weekly, if not more frequently, for this to be a realistic option. So 50 million per month is not going to cut it for everybody, but like I said, there's a lot of companies out there who are working on this. So we are going to need multiple different tests to get widespread testing for everybody. The other downside is that it is a point-of-care test, which means you can't do it at home. It's not an at-home test. You have to go somewhere to get tested, and that is inconvenient. So while BinaxNOW may not be absolutely perfect, it's cheaper, faster, and easier than anything we have on the market right now. Maybe excluding Saliva Direct. Those are the 2 tests that we're using for widespread testing. They're both brand new to the market, so we'll see how they work out in real life. Please subscribe to my channel so you don't miss any of these important updates. I'm Dr. Rachel Johns, and I'm here to help you control your medical problems so that they don't control you. Bye.